Okay.
He's farting.
We're rolling.
Okay, great. Hi everyone, welcome. I am going to share with you tonight some what I think is really exciting information. The name of the talk is Advanced Principles of Healing. So there's a number of principles that I'm going to talk about tonight, and then we'll end with a demonstration with someone on the table. So, the name of our practice, Network Chiropractic. Network is the name of a technique that Dr. Barry and I have studied, among many others. By the way, we have been in practice for 15 years together, since 1997 was when we graduated from chiropractic college. And just a brief history, we met before we went to school. We fell in love in 3 days, and then within 6 months we had moved from New York, where we're both from, to Georgia to go to chiropractic school. Then we transferred out to California to another school there, and then spent the next 5 years going to school together, getting our degrees, and then we had a practice out in California for 5 years, and we've been back here for 10. So in our histories, we have both studied a variety of techniques, a variety of chiropractic techniques. And for those of you who don't know, and we did not know that we were chiropractic patients before we met. We each had injuries from the past. I have a background in dance. Dr. Barry had studied karate at that point, and Aikido, and he had an injury. I had an injury in my past, so we each had been under chiropractic care, on and off for about 15 years apiece. And as far as we knew, all chiropractors did what we had experienced, which was a fairly forceful adjustment to the spine with the hands. And so when we arrived at chiropractic school together, we discovered, much to our surprise, that there are over 100 different actively practiced techniques within chiropractic. And so there's a lot of variety out there, and one of the ways that the techniques differ from one another is in the amount of force that's used in the treatment, in the adjustment. So you go from very low force to fairly high force, and everything in between. And we had both experienced the generally fairly high force techniques in the past, so we were new to the idea that a healing technique could be powerful with a very gentle touch. And right at the beginning of our education, we discovered a practitioner, a woman chiropractor, who practiced with a very gentle touch. And her primary technique was network. And we went to see her as patients. And that was really what turned us around in terms of finding a technique that was really in alignment with just who we were as people, how we wanted to work with people, and the positive effects that we found that this work had on us was really opened our minds. Because at first glance, if you don't know anything about it, it may look so gentle that you wonder, how could this really be effective? But it is effective. And I'm going to explain tonight some of the principles that we feel make it effective. So if I were going to change the name of our practice, or I was at least going to give it a subtitle, it would be something like either mind-body, or even more to the point, brain-body chiropractic. Because when we're talking about patterns that manifest in the body, and for most people who come here, they come with some pattern that they really want to change, and usually it's a pattern that creates pain of some kind or discomfort somewhere in the back or neck. Classic things for chiropractic: neck pain, back pain, headaches, sciatic pain, maybe posture, maybe stiffness. And for most people, these types of patterns in the body do not come from just one moment, one incident. Like sometimes you can be in a car accident and that really can change your body or change your life. But for most people, it's really an accumulation of tension, of stress patterns, of something that has to do with repetitive motion or a certain posture that you're in for work or at home, and that the body habituates to particular kind of alignment and a level of muscle tension. And what we don't realize, or maybe think about often, is that any patterns that are manifesting in the body are coming from where? The main control system is in the brain. So there's two-way communication between the brain and the body. And the brain receives, sends signals to control movement, right? And we do this mostly on a conscious level. So the surface layer of the brain, the cortex, is where our conscious awareness comes from. And there's a specific part of the brain, a little strip on the side there, that's specifically there to control all the different body parts. So this is how a dancer or a gymnast can do these complex movements, or even just, lifting a weight or walking down the street. It comes from the brain orchestrating the muscles to move in a certain way, right? And then underneath that, we have lots of patterns that we're not generating consciously, that are coming from the brain at an unconscious level. And they have to do with how much muscle tension is being held, is being stored, is stuck in a way. It almost has a muscle memory in the body, and we're not doing that consciously. So if you think about, how a muscle works on a conscious level, you tell it to contract and it shortens. That's how it moves the joints it's connected to. And it kind of bunches up and it gets hard. Hopefully, if it's strong, it gets fairly hard. And then you tell it to relax and it lengthens and it relaxes. But there are many areas of the body and many muscle groups which, even when we tell it to relax or we think it's relaxed, like these, sometimes these or these, feel like this. But we're not doing it with our conscious mind. This is a pattern of stress adaptation and storage that's coming from the unconscious mind. And most of the brain does focus without our conscious awareness or direction. And in a way that's lucky for us, because if we had to direct every cellular function and every organ and every piece of digestion and the liver and the pancreas and everything else, we wouldn't be able to do anything but that. You just have to sit there and direct all your organ function. So luckily all of that happens automatically without us thinking about it. But what gets wrapped up in this automatic function is our levels of tension in the muscles. So muscles always cross joints because that's how they move the joints. They use the bones as levers and then they move the body parts. So if muscles are in a consistently or constantly somewhat contracted position, they're going to take those two bones that meet at a joint and they're going to squeeze them together. So you get an internally generated compressive force within the body that makes your whole body, and you can feel this sometimes consciously. If you tune into your body and you're really stressed out, you feel like you're compressed, like things are just squeezed inside of you. And they literally are. Our muscles are squeezing our parts together. That makes it more difficult to breathe. That makes it more difficult to move. The spine is a super important structure in our body because what's inside of each vertebra has a hole in it, and you stack them up, it makes a tunnel, and our spinal cord runs inside of that tunnel. And you could really call it the brainal cord because it has direct connection to your brain. You have a hole in your head at the bottom where the brain narrows down to the brainstem, and the spinal cord, it goes through that hole all the way down inside the spine, and then between each two vertebrae, the nerves branch out, and then they continue to branch and branch and branch, and they go everywhere in your body. And these nerves contain two-way communication. Some of the nerves expressly send information from the brain out to the body, and some of them are dedicated to bringing information back into the spinal cord and back up to the brain. And the brain only knows what's happening. You know, it's like in this dark cavern in there. The only information that it gets, it's cut off from the world. The only information that it gets is what it receives through our body, through our senses, right? So the way that we evolve and develop as individual human beings over our lifetime is really the result of the accumulated effect and meaning that we give to the variety of sensations that we have and the experiences that we have.
From the nerve?
Right, through the nerves, right, through the eyes, through the ears, through smell, through touch sensation on the skin, but then there's also tremendous feedback from there are nerve ending receptors in our internal organs, inside of our joints, lodged in our tissues, so that our body is sending constant feedback from inside and from outside. And then our brain has the job of perceiving and evaluating and defining. And many times, you know, we will hold on to patterns of perception, right, and belief and thought just as strongly as we hold on to patterns of muscle tension and posture. So one powerful way that we have to change the body is through the brain, really the primary way. That is the way that it happens. The body, the way that the brain orchestrates, molds, moves, and controls the body is dependent on, it is called a sensory-driven organ. Depends on the information coming up. So as we're interacting with you on the table, we are communicating information through your nervous system, through the energetic system of the body, up to the brain, and the information gets processed. The brain enters a healing state. You know, many years ago, it became popular, the idea of the A-type personality, and then I think there was the double A and the triple A. But, you know, in the past number of decades, where really the understanding has developed of the mind-body connection, and how there are certain states of consciousness, which mean brain activation states. There are certain states of consciousness which enhance health, and then there are certain states of consciousness and brain activation states that make it more likely that you'll develop disease. And those states have to do with stimulation coming into the body that on some level feels like too much. Or our brain is perceiving it as too much. So you can call that stress. Mm-hmm. And I don't know anyone who would say they lead a stress-free life.
No.
I haven't met that person yet. Maybe they're living in Hawaii. I don't know. But, you know, there are various levels of stress that we have in our lives. Sometimes we have major traumatic experiences. Mm-hmm. Physically, emotionally, psychologically, and sometimes stress and you know, just a little bit is enough to activate that brain state. It could be just something like just rushing from place to place, even some of the places that you go during the day. If you feel like you have to rush there, if you feel like you don't have enough time to do the things that you need to do, or you feel like a constant little bit like of a pushing ourselves or judging ourselves. Thoughts are very powerful. Every thought we think releases specific chemicals in the brain, neuropeptides that accompany those thoughts and the emotions that come with them. And they go into the bloodstream and they circulate throughout our body in a minute. And every cell of our body knows what we're thinking and we're feeling. And you know, I'm the kind of books that I like to read have to do with the brain, healing, stress. We have a book about this thick that's called Perpetual Stress that we're trying to get through right now.
It's too stressful to read.
It's too stressful to read.
Should make it thinner. Too much stress.
But there are our brains, lucky for us, are there is a neurological term called plasticity, neural plasticity, meaning that our brains can change and alter and evolve their structure literally and their function then in response to the type of stimulation that comes in. And one of the books that I'm reading right now is called The Buddha's Brain. And it talks about the research that's been done on people who meditate within different kinds of faiths, or you can call them contemplative practices, and how when they do CT scans or MRIs before and after a certain period of time, and it could be as short as 8 weeks of regular, and it doesn't have to be for an hour even, it can be 20 to 30 minutes. When you activate particular parts of the brain in that meditative state, they can see thickening of up to 1 millimeter on certain areas of the brain. And you might think, oh, well, 1 millimeter, isn't that pretty small? But it's visible, it's measurable, and there are millions of synapses that have been created in that millimeter of brain tissue. So our brain, synapse, oh, I'm sorry. When nerves, the way a nerve cell looks is that it has a round part called the cell body where the nucleus is, and it has the DNA and everything in there. And then it has this long branch called the axon that comes out. And this is where the nerve impulse or the electrical signal coming from the brain travels along this axon. And then at the end of it are all of these branches, like roots of a tree. And all of these branches reach out, and at the very tips, they will almost touch, very super, super small space, they're meeting another neuron where it sends the signal across, and then the information continues on to another place, right? So where those nerves meet is called a synapse. And there are trillions in our body because there are so many nerves, and each nerve has tremendous number of branches that reach out and to communicate, creating a network within the nervous system.
So like a lot of little Starbucks meeting places.
So when a nerve pathway is stimulated in a repetitive fashion, it will literally grow more branches and reach out and touch and talk to more nerves. You get more synapses. In addition to that, we now know that there are stem cells, the place that we as adults still have stem cells, which are like embryonic cells that are undifferentiated and can turn into a variety of different kinds of cells. The stem cells that we have are in our bone marrow, which leave our bone marrow, go into the bloodstream, and for many years it was understood the main purpose of these cells was turning into blood cells, red blood cells, white blood cells, platelets. And the understanding has come through a research of a particular person who won a Nobel Prize for this, that those stem cells also leave the bloodstream, cross the blood-brain barrier, go into the brain, and become neurons. So we can actually increase the number of neurons, not only the interconnections between the ones we already have, but literally the number of neurons in the brain. And where those neurons go and which type of brain cell they become depends on what we're using the most. So what we are doing that's so profound with this work is that we are helping you to enter into a state of consciousness, into a brain organization pattern that is a powerful healing state that's going to help you to develop over time and enhance the function of the parts of the brain that lead to greater health, to greater inner peace, to greater sense of feeling centered, of literally joy and happiness. On the left side of the frontal lobe is where many positive emotions are generated. Joy, happiness, a feeling of peacefulness. And this is one of the areas that actually thickens, is the anterior part of the frontal lobe. Another part of the brain that develops in this deeply relaxed meditative state is called the insula. And the insula has to do with body awareness. So this is one of the things that almost everyone who comes here will say they've experienced over time is they have a much greater sense of body awareness. They literally can just feel, it's almost like if you saw an image and it was in black and white, except it was kind of faded and it was kind of gray, and you could kind of see it, but it was a little foggy, it was a little fuzzy. And then if you were to like bring it into full color, three-dimensional hologram, and you saw it that clearly, it's like that is what's happening with the feedback from the body and the development of the insula, is that you are getting this much more highly developed and enriched image and sensation from your body to your brain. And one of the things that's really fascinating about this is not only does that help you with your posture, with being, having that sensation guide you to do physical things in such a way that you're putting less stress on your body. So an example of that would be someone who is sitting at their computer and their monitor's too low and their keyboard's too high and their monitor's off to the side and they're always turning their head to one side, and they've been doing it like that for 10 years and they've been in pain, but they never really thought too much about it, and it just felt normal. And then they start coming here, and all of a sudden their body, they start getting this enhanced feedback from their body, and their body says, hey, what's your monitor doing over there? You're twisting your neck 8 hours a day, that's not good. And they take it and they put it over here. So this can happen if I don't tell them to do it, their body will tell them to do it, and it'll happen spontaneously. People find they need to adjust the seat in their car differently. They need to adjust their seat at work, in their chair, differently. The way that they bend down to pick something up, they might feel innately, that they want to bend down like this because the other 100 times that they've bent down like this, all of a sudden doesn't feel so right anymore. So one of the fascinating things about the insula and about increased body awareness is that linked to that is the development of empathy and compassion. So there's something about when you can feel into yourself, you can feel other people. And this creates a higher level of intimacy, of connection, and of a richness in our relationships with each other. And many, many people who come here also over time will say, my relationships, I feel like my relationships are improving. I feel closer to people. I feel closer to myself. So that's where it starts. It starts in our relationships with ourselves, and then it branches out. So this is where this brain-body, mind-body / emotions / energetic system, our bodies are energetic systems. We are energy beings. And if you think about, what that means, you can go all the way to quantum physics and talk about how, when you get down small enough, it's all just space and energy and light. And then there's just on a measurable level, tremendous amount of electricity in our bodies that is coursing through us all the time, from our heart beating, our nerves sending electrical signals, the brain creating brain waves. Then we have a magnetic field that surrounds this electricity. And then we have, if we study the ancient systems from India and China, we have energy vortexes, and we have lines of energy that go through the body. And there are scientific experiments that have been done where they take radioisotopes and they inject it into acupuncture points, and then they can actually measure that those radioisotopes move up along what we would think of as an acupuncture meridian, where there is no blood vessel there. They're not moving in the lymph system. It's not, as we have learned to think of anatomy, the normal channels of communication or the way things move. So these are the areas of interest that Dr. Berry and I have had for many, many, even before coming into chiropractic. We studied massage, shiatsu. In shiatsu, you do learn all of the meridians and the acupuncture points, and you use, but instead of using needles, you use your hands. You work on them as pressure points. There's Reiki. There are various forms of energy healing that you can do touching or not touching. And then there are the variety of chiropractic techniques that we learned. There's craniosacral, cranial work, Traeger, in which you create a rhythmic motion in the body. So there are so many ways that you can communicate with and bring information through the body up to the brain so that the brain can enter this meditative healing state. And part of this state is called a relaxation response. Relaxation response, that term was coined in 1975 by Dr. Herbert Benson, who taught at Harvard Medical School, and he started the Mind-Body Institute. And he really has been a pioneer in this area of talking about what is the power and the purpose of the parasympathetic nervous system, which is shown in this chart here, these nerves that look kind of blue-green coming out of the very top and the very bottom of the spinal cord. Because a lot really had been studied, a lot more had been studied about these nerves shown in yellow coming out of the middle, which is the sympathetic nervous system, which creates a stress response. It's also activated by physical demand and physical activity. But for most of us, it's likely activated a lot of the time just because of the levels of stress that we're living with. So in the 30s, we started really learning a lot more about the stress response and the stress hormones and the adrenal glands and the impact that that had on our health in a negative way. And it wasn't until 40 years later that someone thought to ask, well, what about the other ones? This is a system that has two opposing sides, and only one side had really been studied. In terms of its relationship to health, we knew that the green nerves, okay, they activate the digestive system, they activate peristalsis, they help lower blood pressure, but it hadn't been really looked at as part of a healing system. So the parasympathetic nervous system is very important. And what happens when the brain and consciousness go into a deep state of this meditative healing state that happens during the treatment is that the green nerves become very active, the parasympathetic nerves. And as that happens, all of the muscles in the body begin to relax. For most people, this is the primary cause of the pain that they have. Even if once upon a time it started with an accident or a fall or an injury, if it hurts after 6 to 8 weeks, it's from muscle tension. Because it only takes 6 to 8 weeks for the soft tissue to heal and for the inflammation to primarily resolve. What's left after that is muscle memory, is stress patterns, is muscle tension. And in order to help change those unconscious chronic patterns of tension, to free up the body, so what we're looking for in our progress exams, to indicate to us that this cascade of changes is taking place, that the brain is altering its structure and function. This in turn is feeding into the way the autonomic nervous system is functioning. That in turn is changing the levels of stored muscle tension. Once we start releasing that muscle tension and lengthening the muscles, then your flexibility comes back. Your range of motion increases. For most people, the pain goes away. So a healthy spine should be not only flexible, but fluidly flexible. And this is one thing that we're testing for as a little bit at the end of each treatment, and then also more thoroughly in our periodic progress exams, is we want to see, is your flexibility coming back? Is your alignment, your posture improving? We measure that with digital photographs from the front and the side. Bless you. Is the posture improving? Are you feeling better? Are your symptoms, your pain or whatever the symptoms were when you came in, are those resolving? And then in terms of that mind-body connection, many people will also report, I'm feeling less depressed. I'm feeling less anxious. I'm sleeping better. I can focus better. My creativity is enhanced. So the same parts of the brain that are activated in a fairly deep state of relaxation, by the way, is also called an alpha brainwave state, or even deeper, a theta brainwave state. So in those brainwave states, alpha and theta, you become more and more deeply relaxed. And when you get into a deep theta state, you feel like you are floating almost. You go into a very deep inner state where you're leaving a state of doing and you're entering a deep state of being. And that is a healing experience. And sometimes it's hard to get up at the end, or you don't want to get up. because it's a powerful place to be. But what's happening every time you go there, and someone said to me this morning, you know, I zoned out. And I said, it's not that you zoned out, it's that you zoned in. You zoned into yourself. You zoned into a healing state. So every time you go there, every time you come here, every time you go there, every time you have that experience, you are literally creating this development within the architecture of your brain. You're supporting that, and it's happening. It's going to happen, because you can't enter that type of repetitive experience and not have it happen. So the old patterns that may be stored from many, many years from all these various stresses and traumas become replaced with new patterns, patterns of ease, patterns of balance and flexibility, patterns of centeredness and focus. And more you will find that these healing effects carry over into the rest of your life. And that you get better and better at letting go of stress and tension. So that after 20 years of Dr. Barry and I studying and receiving, you know, first from other practitioners and now from each other, this work, if I've had a particularly difficult week or day or whatever it is, I can get on the table and Dr. Barry can adjust me, and in 15 minutes I can experience a profound change in my state of mind, in my state of physical stiffness or of muscle tension, or if I'm experiencing pain. And it's really phenomenal that the body is able to develop the ability to do that.